If you're dealing with fibromyalgia, you know just how confusing finding the right treatment can be. There are so many medications, so much conflicting advice. It's really tough to figure out what actually works. So today, we're going to cut through the noise. We're breaking down a major scientific review that brought experts together to create a clear guide on medications for fibromyalgia. Let's get into it.
This is the big question, right? If you have fibromyalgia, you've probably asked yourself this 100 times. Maybe you're on medication right now, or you're thinking about it, and you just want to know, what does the hard evidence actually say? Well, in this explainer, that's exactly what we're going to find out.
So, before we jump into the treatments, let's just make sure we're all on the same page. Experts define fibromyalgia as this collection of symptoms: chronic pain all over, fatigue, sleep problems. But the key part, the thing you really need to understand, is the engine driving it all: central sensitization. Think of it like this. Your central nervous system's volume knob for pain gets stuck on high alert. It's amplifying everything. And that's crucial for understanding why some meds work and others just don't.
To make sense of all this, here's our game plan. We'll start with how the experts actually rated the evidence. Then we'll get into the good stuff: what's recommended, what's still kind of a question mark, and just as important, what's not recommended. And at the end, we'll wrap it all up with the key takeaways.
So how did these top rheumatologists even come to these conclusions? Well, it wasn't just a matter of opinion. They used a really structured and rigorous system to make sure their recommendations are built on a foundation of solid scientific evidence. The system is called BASCE. It starts with a massive search for all the best scientific papers out there. We're talking high-level stuff like meta-analysis. Then, one group of experts goes through and scores all those studies. After that, a second, even larger group of 22 specialists reviews all of that work and votes. It's this whole multi-step process designed to weed out bias and get to what the evidence truly says.
And get this, the bar for agreement was really high. For any recommendation to make it into the final guide, at least 70% of the experts had to agree on it. If a vote didn't hit that number, they had to debate it and vote all over again. If it still didn't pass, it was out. So what we're about to see represents a really strong consensus from the field.
All right, now for the part I know you've been waiting for. After all that rigorous review, which medications actually made the final cut?
And here it is, the short list. The experts strongly recommend just 5 medications. And what's so interesting is that you can see how they target that central sensitization we talked about. You've got antidepressants like amitriptyline and duloxetine that work by boosting chemicals in your brain that help turn down the pain volume. Then there's pregabalin, which is an anticonvulsant that helps calm down those overexcited nerves. And finally, cyclobenzapine, a muscle relaxant, gets a recommendation specifically for helping improve sleep, which is a core issue in fibromyalgia. This chart is really cool because it helps us understand what moderate effectiveness actually means in the real world. Let's look at 2 of the most common options. See that number needed to treat, the NNT? That tells us how many people have to take a drug for just one person to get a significant 30% drop in pain. For duloxetine, it's about 7 people. For pregabalin, it's closer to 9. But then you have to look at the other side of the coin, the number needed to harm, or NNH. This shows how many people it takes for one person to stop taking the drug because of side effects. For pregabalin, that number is pretty low, less than 8 people. Compare that to almost 15 for duloxetine. This really spells out the trade-off you're always dealing with between the potential benefit and how well you can tolerate the drug.
Okay, so that was the yes list. But what about all the other drugs people use? This next category is just as important. It's for treatments where the science just isn't strong enough yet to give a firm yes or a firm no.
This is a huge one. SSRIs, drugs like fluoxetine, are some of the most prescribed antidepressants on the planet, and doctors often use them for pain. So where do they stand when it comes to fibromyalgia?
The expert consensus was pretty clear. There's just not enough evidence to recommend SSRIs for the main symptoms of fibromyalgia. Now, they might help if you also have depression, but the studies show they only have a pretty small effect on pain, and they don't really move the needle on fatigue or sleep problems. All right, what about a couple of other treatments you hear about a lot in patient groups? I'm talking about low-dose naltrexone, or LDN, and the pain medication tramadol. Let's see what the review said about those.
For both of them, the conclusion was basically the same: not enough evidence. This quote about LDN really sums it up perfectly. Yeah, there are some promising little studies out there, but the evidence is still considered weak. Why? Because the studies are often too small, too short, or don't have a proper placebo group. It's the same story for tramadol, where the evidence is pretty limited and inconsistent. Without bigger, better trials, the experts just couldn't give them a thumbs up.
Okay, now we're moving into a really critical section. Treatments that the scientific evidence suggests you should either avoid completely or be extremely cautious about when it comes to fibromyalgia. When you're in pain, what's the first thing most of us do? We reach for an over-the-counter anti-inflammatory, right? Something like ibuprofen. It seems like a totally logical thing to do. But what does the science say?
The consensus here is a hard no. And the reason goes right back to what fibromyalgia is. The pain isn't being caused by inflammation in your muscles or joints. It's being driven by that central sensitization in your nervous system. So anti-inflammatory drugs just aren't targeting the root of the problem. In fact, one of the most respected types of medical reviews found zero difference between taking NSAIDs and taking a sugar pill.
So what about the big guns, strong opioids? They're the most powerful painkillers we have. Surely they must help with severe fibromyalgia pain, right? This might be the single most important and frankly shocking finding in the entire paper. Not only is there no good evidence to support using opioids for fibromyalgia, but the research actually shows they can make things worse. That's right, the evidence suggests that long-term opioid use can actually increase pain, make it harder to function, and worsen depression and sleep for people with fibromyalgia.
And that not recommended list doesn't stop with opioids. The expert panel also found no evidence to support using cannabinoids, or intravenous ketamine or lidocaine, or benzodiazepines like Xanax for sleep and anxiety, or psychostimulants for fatigue. For all of these, it's the same story. The science is either weak, inconsistent, or just not there, so the experts couldn't recommend them.
Whew, okay. That was a ton of information. Let's take a deep breath, zoom out, and boil this all down to the most important things you need to remember from this deep dive. So here's the bottom line. First, there's a very short list of medications that have solid evidence for providing moderate benefits. Second, a lot of the things people commonly reach for, especially anti-inflammatories and opioids, aren't just ineffective, they could actually be harmful. Third, when you hear not enough evidence, that's not a final judgment. It's a call for scientists to do more research. And maybe most importantly, this review stresses over and over that medication is just one piece of the puzzle. An integrated plan that includes things like exercise and education is absolutely essential. And all of this leads us to our final big picture thought. The science is telling us loud and clear that while some drugs can certainly help, there is no magic pill for fibromyalgia. Even the very best options only offer moderate relief. And that forces us to ask a much bigger question. What does a truly effective approach to managing this condition look like? And how much of that future lies outside of the pharmacy?